Welcome to the Crook County Domestic Well Public Health Open House. We created this video to provide information to all community members in the Prineville area concerned about their domestic well safety, including those attending this May 30th meeting and those viewing from home. My name is David Fair, and I'm a public health toxicologist with the Oregon Health Authority. During this presentation, I will be sharing information for residents in the Prineville area that use domestic wells and are experiencing problems with their well. A private or domestic well is a groundwater well used to supply water for an individual residence or a water system that is not used by the public. I will share information about services OHA can provide for well users, including individual health consultations and a potential community well water study, as well as resources to seek testing for your domestic well. Staff from the Oregon Health Authority, or OHA, prepared this information for people in the community who are concerned about the quality of their well water. We understand there are concerns about human health, animal health, plumbing and appliances, and odors, taste, and appearance of well water. OHA has a focus on human health. Public health toxicologists like me work with communities to understand whether there are health risks from exposure to harmful substances in water, air, or soil, and to recommend actions to reduce or eliminate risks when found. OHA staff are not physicians or healthcare providers who can diagnose or treat illnesses of individual people. This short presentation is intended to explain the kinds of services and information OHA may be able to offer in this situation. I will also explain how information you share with us will be used if you choose to share it with us. One role of a public health agency is to identify health risks to a community. When we talk about or estimate health risk, we mean the chance or likelihood that something, like drinking water, will harm or affect your health. In order to understand the health risks posed by well water, OHA needs to know what harmful chemicals are in the water and in what amounts. Oregon Health Authority does not have the expertise or resources to test water quality. We rely on data from environmental testing laboratories and environmental agencies like the Department of Environmental Quality or Environmental Protection Agency. Those organizations produce data about what is in the environment, and OHA evaluates the data to understand what it means for public health. Well testing is the only way to know for sure what is in the water. In Oregon and across the country, domestic well owners are generally responsible to test their well water to ensure drinking water safety. OHA can assist you in finding a testing company, deciding what to test for, and helping to interpret your testing results. We know that some people have already had their well tested. Other people want to have their well tested. In the next slides, I will share more information about next steps for both groups. If you have already had your well tested and know your results, one of our toxicologists can help you understand the testing results in your laboratory report. We can schedule a time to talk with you about them on the phone after the May 30th community meeting. Please look for the sign-up sheet at the OHA table in the main room or email us to set up an individual phone call with a toxicologist. If you have not had your well tested, you may want to seek testing. The fastest way to find out what is in your water is to get it tested yourself through an environmental testing laboratory. OHA has information about how to sample your own well. OHA can help you decide what contaminants to test for, how to find a certified laboratory, and help you interpret your sample results when you get them. If you sample your own well, the testing will be at your own expense. OHA can also help connect you to experts in well maintenance and treatment systems. Our colleagues at the Oregon Department of Environmental Quality, or DEQ, are here today to gather information about the location of wells where people have concerns. DEQ has requested special funding for a community well water study and will use the information gathered today to develop a plan to implement if funding becomes available. DEQ would also need permission from well owners to sample their well. The information OHA is collecting from community members about health concerns will also help inform the plan. For example, we understand people believe water is causing skin reactions. We would ask that any DEQ sampling plan test for chemicals known to cause skin reactions. If DEQ receives funding, they will use it to hire and oversee an environmental testing firm. OHA's expertise is to assess the potential risks water could pose currently. We cannot link the health problems that have already happened or are currently happening to your well water. When OHA works with individuals or communities to assess their potential health risks, we call it a health consultation. Here are some questions that health consultation is likely to answer. Am I or my family member likely to become ill from drinking my well water or other household uses like cooking, laundry, bathing, and brushing teeth? Who in my family is likely to be the most sensitive to health effects from contaminants in my water? What can I do to reduce the level of contaminants in my drinking water? Where can I learn more about well maintenance? A health consultation could answer any of these questions. Here are some questions community members may have that a health consultation would not answer. Where are the contaminants in my well coming from? Who is responsible for the contaminants in my well? Are contaminant levels high enough to harm my animals? Are my or my animals' current health problems caused by the contaminants in my well? How many people in the community are sick because of their well water? Those first three questions may be answered by other agencies if they have the resources. No state agency can answer the last two questions regardless of resources, because the types of health effects caused by well contamination in humans and animals can be caused by other things as well. It is not possible for OHA or any agency to determine which existing illnesses in the community are caused by well water and which are caused by other things. If OHA can get high-quality test results from many wells, we can write a report called an OHA Community Well Water Study. Rather than looking at individual testing results on a case-by-case basis, an OHA Community Well Water Study describes the community's health risks based on the amounts and types of contaminants in the well water across an area. An OHA Community Well Water Study would end with conclusions about health risk and with recommendations. OHA's recommendations may be addressed to well users or to public agencies. The aim of those recommendations would be to protect human health by reducing or preventing community exposure to harmful chemicals from their wells. An OHA community well water study requires well water sampling data collected by a partner agency like DEQ or their contractors. A study would not provide any funding to well users or any other direct support. It is an informational resource with a set of recommendations. OHA does not have authority to regulate domestic wells, so cannot require that recommendations be implemented. In order to better understand what is in wells in the area and what health risks are, OHA will need some information from you. In a separate room during the meeting, there will be agency staff from OHA and DEQ that can help answer your questions and collect the information we need from you. Staff from the Oregon Department of Agriculture, or ODA, will also be available to collect your information about animal health concerns. There will also be questionnaires you can use to provide us your answers in writing if you don't want to talk with anyone. If you are watching this before or after the meeting, this presentation and questionnaires are also available on OHA's website at oregon.gov/crookcowells. Any private health information you share with OHA staff will be strictly protected and not subject to public disclosure laws. Written information you share with state agencies about your well or animals may be subject to public disclosure laws, although agencies have no plans to post the information or to make it easily accessible. OHA can share helpful information and resources about well water and testing. If you have had your well tested, contact us for help interpreting your testing results. To get your well tested soon, OHA can provide a list of accredited laboratories, help you decide what to test for, and interpret your results. If special funding becomes available for state sampling, OHA will work with DEQ to develop a community sampling plan. Thank you for your kind attention.